All right, welcome back, everybody. Time now for Healthy Minds, Healthy Lives. Did you know that there's a 56-acre campus in Lebanon, Connecticut that's dedicated to helping men in recovery? It's a beautiful campus helping close to 100 men at any given time.
It's called SCADD, which stands for Southeastern Council on Alcoholism and Drug Dependence.
Yeah, they've been doing great work for years, and I had a chance to pay them a visit a short time ago. Take a look.
Welcome to SCADD, the Southeastern Council on Alcoholism and Drug Dependence, located in Lebanon, Connecticut. I'd like you to meet Stacy Lawton, the Chief Executive Officer of the organization, and Ashlyn Hayes, Nurse Manager of the Lebanon Pines division of SCADD, which is where we find ourselves today.
So this 56-acre property here is the home of Lebanon Pines. There are 98 residential beds that are licensed by the Department of Public Health and partially funded by the Department of Mental Health and Addiction Services.
What does SCADD do?
So SCADD is a private nonprofit agency, and we provide substance abuse and mental health treatment for folks who might not be able to afford treatment otherwise.
Stacy started here in 1993 answering phones.
I was answering hotline calls at our withdrawal management facility, and I was afforded a number of opportunities to grow professionally in my time here. I've worked in the Human Resources Department and the Development Department. I've done grant writing. I've worked in all of the different programs here in SCADD's continuum, and I am really privileged in 2019 to have been asked to be the Chief Executive Officer. We have a full continuum of services, starting with withdrawal management, which is a 20-bed facility down on Coit Street in New London. We also have inpatient treatment for men here at our Lebanon Pines facility. We operate 3 transitional treatment programs out in the community. There are transitional housing programs for folks who are integrating back into the community. 2 of those houses are for men, 1 is for women, and then we have an outpatient behavioral health clinic on Bank Street in New London. In addition to those treatment programs, we also offer recovery support programs out in the community. One of the newest pieces that we've integrated into our residential treatment programs is primary care, because we know that that is something that many of our folks haven't availed themselves of in a very long time.
They even treat patients with hepatitis C here, which often gets in the way of treatment. Ashlyn tells us more.
Oftentimes we would get people that would come here and they would either leave because we didn't offer that service, and nor did any other place, or they at least wanted screening. So we identified pretty early on when I got here that that was something that we needed to address. So the journey began, and it was back in about October. Today we are up and running. We have successfully treated 9 individuals, screened and treated 9 individuals successfully, and we have the capacity to treat everybody.
Who comes here?
So the average age of folks who come here are usually between 30 and 40.
Interesting.
We have folks who are primarily receiving a Medicaid benefit and don't have a lot of other resources. You know, the folks that we serve here at Lebanon Pines are not folks who are able to go to Betty Ford or have a lot of other kinds of resources to be able to find services in other ways. Our population is often a population that has multiple diagnoses, right? So many of our folks have a mental health diagnosis as well as a substance use disorder diagnosis. It is often a polysubstance diagnosis in that they are not just addicted or using one substance.
The team here at SCADD is ready to help.
It is a wonderful place to get help. Our team is the most compassionate and dedicated team that there really is in the industry. They are really the folks that give life to our mission, and they believe in second chances. They are the epitome of our core values. Many of them serve as role models in terms of folks that are in recovery and just are able to demonstrate what a life in recovery can look like, that it can be fulfilling and happy and fun. You know, I think that that's often a difficulty for folks who are kind of taking that first step and getting themselves into treatment, is they can't envision what their life looks like without using alcohol or drugs, or being surrounded by the people that they use with, right, in those really unhealthy relationships. And especially for our young people, understanding that you can have a happy and fulfilling life without drinking or without using. So many of our staff serve as role models that is possible, and they are very much the inspiration for hope.
Just one of the many beautiful residential homes that the clients stay in. Close to 100 men, again, are on this facility. 56 acres in all. That used to be a country club back in the 1960s.
While the men are working on themselves, they're also working on different areas of the campus.
Stacy, just an absolutely gorgeous garden behind us.
Thank you. Thank you. So this is the fruit of the labor of many of our residents that live here at Lebanon Pines. SCADD is a United Way funded agency, so we are super excited to share some of the produce that will come out of the gardens this spring with the Gemma Moran Food Center.
The work therapy continues in the maintenance department. Clarence and Jeff work in this area for SCADD.
A lot of work therapy takes place here, right, guys?
Yes, we have work therapy for the clients. They come here and we allow them to do projects.
In closing, SCADD is looking to hire. Yes, they need more people to help people.
We are really looking for licensed clinicians who want to come and work in a rewarding setting where they're able to give back to clients and to work with a tremendously dedicated team. We have a really competitive benefit package. We are making huge investments in the development of our staff, and I'm personally a testament to the growth that can occur here when you start just kind of at an entry-level position. Lots of opportunities for advancement, wonderful work environment, professional development, competitive benefits. We'd really encourage people to go to licensedclinicians.org and apply for a position.
All right, if you'd like to learn more about the treatment options at SCADD or to get more information on how to become part of the staff, please head to their website. It's SCADD.org. Okay?
What a great place.
No, it is. It's incredible right here in Connecticut, too.